So anybody can do this.
Can you give us a recent example of somebody that you've helped?
Yes, I trained this lady named Barbara, and Barbara had breast cancer a few years ago, so obviously her immune system was kind of on the weak side, and she contracted the coronavirus, and she reached out to me recently to tell me that, she had tremendous breathing issues and that she was terrified, and it created a lot of anxiety and depression in her life. And she says, I implemented the breathing you taught me and the meditation techniques, and she goes, it was incredible. It totally reduced all her anxiety and stress, and she was able to breathe more efficiently, and now she's all better. So that was one person, and there's been several with asthma. In fact, my wife was one of the primary examples. When I met her, she was a nurse, and she worked with profoundly retarded children with respiratory problems, and she was coughing so terribly. And I said, what's wrong with you? And she says, oh, I get bronchitis every year. I'm asthmatic, and this is just what always happens. And I taught her my breathing technique, and Rhonda, it's 40 years later, and I never saw her have one attack.
Wow.
So, yeah, it's incredible.
That's amazing. So of all of this, I know there's so much that you can teach. Is there one simple technique that you can share with our listeners that will help them to be able to put something into place, pretty quickly that they could do?
Absolutely. And, what I'm going to teach you in 1 minute is something that all of us have done as children. We all have done deep abdominal breathing through our nose, which I'm going to go through the technique in a minute, but this is nothing that you don't already know. It's just sometimes we forget. And I would say due to the stresses and all the toxicity of life and emotional traumas, people start to breathe very shallow from their chest. It's estimated that 40 to 50% of the population are mouth breathers when we should be nose breathers. So let's go through a quick breathing technique. Before we do, I'd like you to just sit at the edge of your chair, and I want you to become aware of your posture. Is your head straight? Are your shoulders level? Is your back straight? You might want to move your pelvis back and forth and feel your lower back getting straight. And that will automatically relax your chest. See, part of the reason people are stressed out because they're centered in their chest or in their head. Their center of gravity is there. So we're taught, push your chest out and suck your gut in. Now, you do that, and you tell me if you could breathe. It's so hard to breathe like that. You have to become a shallow chest breather. So we're taught the wrong posture right off the get-go, which inhibits our breathing. So now I'm telling you to do just the opposite. Relax your gut and let it protrude. I know we don't like that too much, but it's important to your health. So relax your chest, and now take your fingers and stick them into your solar plexus, right under the rib cage, under your sternum. And that should be soft if your shoulders are forward enough. You do not want your shoulders pulled back the way we're taught. It should be not too far forward and not too far back, just in the middle. So now, take your left hand and put it on your belly button and your right hand on your chest, and I want you to stick the tip of your tongue on the roof of your mouth and just gently touch it there. So now we're going to inhale through our nose, and the first movement you're going to feel is your lower abdomen moving outward. So no chest movement yet. So take a deep breath in through your nose slowly and feel your belly protruding. Okay. Now we're going to use the rest of our lungs. So you're going to feel the air going into the bottom, middle, and top part of your lung. So inhale, feel the lower abdomen, bottom, middle, and top part of your lung, and now hold for a second. Now connect with the exhalation, and before you exhale, slowly exhale, very, very slowly, until all your breath is out, and you still keep your belly a little full at the navel level. So you want to bring the center of gravity to your navel and take it out of your chest and your head. So inhale. Feel the belly expanding.
Mm-hmm.
Feel like you have a balloon. Feel like you have remember when we were kids and we used to go in the swimming pool and have those tubes around our midsection? That's the feeling you get, like you have a little tube around your midsection. You feel the sides of your body expanding, and the back will put a little pressure on your kidneys. And that's it. It's that simple. So you inhale through your nose, fill the lower abdomen, fill the lung to capacity, and exhale very slowly. Now, if you do this...
That was awesome. I think anybody could do that simple technique, especially now in COVID, where the anxiety is so high for people, the isolation is high. This is such a great technique. So, Michael, if people want to learn more about your techniques and reach out to you, what's the best way for them to do that?
Okay, so if they go to Dr. M. Posner, that's DrMPOSNER @gmail.com, and they email me, I'd be happy to send them some of my special bonus gifts. I will send them a free digital copy of my best-selling book, and I will let them join my private Facebook group for free, where they could get a lot of my interactive lessons to incorporate into their daily life to transform themselves in mind, body, and spirit.
Well, Dr. Michael Posner, I am so excited that we had you on the show today to share your backstory and also some of your successes and a great technique that anybody can put into place, especially now during, such a challenging time for everybody. I'm sure in the show notes people can find your Facebook group and your contact information. And I just want to thank you so much for joining us. This is Rhonda Schur, the founder and hostess of Unleashing LinkedIn, where I get to interview all kinds of amazing guests every single month, and also to share with you how you can leverage LinkedIn so that you can get out of that LinkedIn Witness Protection Program and learn how to be the only logical choice on LinkedIn. Thanks again, Michael, and hopefully you'll get a lot of people that will be reaching out to you.
Thank you. It's my pleasure being here.
Okay, stay safe and healthy.